joining us and taking some time to have an important conversation about childcare that we know is foundational to our economy, and certainly having an impact in the midst of the dual pandemics that we face in our region and in our state. Today's session will be recorded. The presentation that you see from ReadyNation will be made available afterwards, as well as 2 reports that they will reference. And we have certainly left time for some questions at the end, so I'd encourage you to use the question and answer feature in your toolbar. For the past several years, the Chamber has really begun to dig into the issue of childcare as part of our economic infrastructure, recognizing that we've got a demand issue, we've got an affordability issue, and we've got an equity and disparity issue when it comes to childcare. That has been exacerbated with the onset of the COVID-19 pandemic. So today we're fortunate to have 4 great voices to talk about this issue. We're joined by U.S. Senator Tina Smith, who long before the pandemic was a champion on childcare issues and has certainly been rolling up her sleeves in Congress to be helpful on this issue. We have Jeff Connor-Naylor, the Deputy Director of ReadyNation, along with his colleague Diane Browning, who is the Director of Federal Policy at ReadyNation. And then fortunate to be joined by Chad Dunkley, who is literally in the trenches every single day. He is the CEO of New Horizon Academy and the president of the Minnesota Child Care Association. So we are going to begin with a presentation on a little bit of level setting from the folks at ReadyNation, and I'm going to turn it over to Jeff and Diane.
Great, well, thanks so much. Okay. Great, well, thanks so much for the opportunity to speak with this group this afternoon about this very important discussion that we have been working on for quite some time. Next slide, please. So before I begin, just a brief overview of who we are. So ReadyNation is the business leader initiative of the Council for a Strong America, which is a national non-profit organization. We operate as a business membership organization. We have about 2,700 members from across the United States that include executives from Fortune 500s, leaders from small and medium sized companies, and then leaders from chamber groups as well. And our main goal is really to promote policies and programs that build a strong workforce and economy. So back in 2019, we commissioned a report that included a survey of parents with children aged 3 and under. And then we did an economic analysis around that as well. Next slide. And this was all in relation to the child care crisis that we have in the United States. And what we found from the survey was that 86% of those who have infants and toddlers said that childcare and problems with it impacted their ability to get to work, to focus at work, and then to climb the ladder of their career. Next slide, please. And what we found is that childcare does not work for 3 main reasons. The first is access. Families need to be able to simply be able to access care. Affordability. Will they be able to afford care? Is it out of reach because it is too expensive? And then finally, quality as well. Next slide. So what we found is that this has caused a $57 billion hit to the economy. Now, keep in mind here that this figure comes before the pandemic hit. So before the situation that we are in now, we already had a child care crisis. And there's also a point to be made here that because we are looking at children age 3 and under, this could also be an under estimate as well. Next slide. So let's dig a little bit into where this figure comes from. So first, it reduced parents' ability to stay at work, to focus on their job, and then to climb in their career as well. So some had to leave work early. Some may need to miss a full day of work. They might have to turn down a new job as a result of a disruption or the lack of being able to access care. They might not be able to participate in training or education that would allow them to move up. And some, of course, in worst case situations, had to quit a job or got fired from a job. And we found that the hit there was about 37 billion a year. Next slide. So when workers are not able to be productive at work, then that means employers will lose revenue. They will also have increased job search costs as well as they look to fill jobs that they've had to lose as a result of parents in their care. And then, of course, there's also just the cost to manage disruptions that their employees go through as a result of problems with childcare as well. And we found that that was about a $13 billion hit to the economy. Now, of course, when people are not in jobs, when they're not able to work as much as they would like, there's a hit to the taxpayers as well. So on the one hand, if they're not earning as much as they could, or if they've had to quit a job, then they're not paying federal income tax or state income tax as well. Also, on kind of the same flip side, they're also not spending as much. So there's also an impact to state sales tax collection as well. And we found that there's a $7 billion hit to the economy there. Next slide, please. So the pandemic has simply exacerbated this. So we had a crisis already, and now we have a crisis on top of one. And child care providers are struggling to keep their doors open, which is what we are seeing and hearing across the United States. Some have had to close for a certain amount of time. Some can only serve a certain amount of kids. They may not be able to serve all of the kids that they are able to serve. Parents are not necessarily returning to work at the same time as parents maybe are still unemployed. Our parents are working from home, as I am. And then for providers, they also have to deal with the added costs of making sure that their facility is safe, sanitized. And then there's also, of course, a cost to train everyone up on these new rules to make sure that everyone is safe. Next slide. So this really has implications for our recovery from the pandemic. Of course, there's the increased costs, but some providers may permanently close their doors. So when we begin to come out of this, then parents are going to want to find care where their kids can stay. And that care might simply not exist. And of course, that has implications for the economy and for getting everyone back to work. Next slide. So just a brief point here about the child care sector in general. So first and foremost, when we think of child care, we typically think of center-based care. But the reality is, and we commissioned a second report this year that looked at home-based care specifically. And this is care that it sounds like what the name is. This is care where folks offer the service within their homes. And we found that over 97% of all care settings across the United States are home-based. And they serve a majority of kids to ages birth to 5. Now, interestingly, home-based care may be a preference during this time because there are fewer kids for every adult. So in a home-based care setting, you might have 5 kids, or in a center-based care, you might have 30 to 50 kids. So when you think of spread of COVID-19, you might want your kid in that smaller environment. The other very important thing about home-based care is there is fewer center-based care opportunities in rural areas of the United States. And so people rely much more on these home-based care options, which also include family and friends as well, who kind of watch kids while mom or dad is away at work. And these also serve folks who work non-traditional hours. Next slide, please. So really now is the time to stabilize this very important sector, to really help providers afford the cost, to keep their doors open, to stay open, considered a reduction in the amount of kids that they can see. And then there's also ways that we'll talk about in a bit that we can serve lower income families and workers as well. Next slide, please. So to sum up, we already had a crisis with childcare, and then the pandemic hit. If we want our country to go back to work, of course, we need to stabilize this sector of our economy so that when we're ready to go back to work, it's there for families to be able to access. Also, we said at the beginning that there's a $57 billion hit to the economy. Well, with this, that could continue to get worse if we don't take action now. So with the final slide, I'll just say, if you are interested in, and you can switch slides now. I'll just say that if you are interested in our organization, we are a free private network. There's no costs, there's no obligations. We simply are here to support business folks to raise their voice on issues like this. So with that, I will hand it back over to Jonathan now.
All right, thank you, Jeff. Great information there, and a reminder that we will be sharing out the 2 reports that you referenced during your presentation. We're going to move next to Senator Tina Smith. Earlier I referenced she's been a great champion of the child care issue, long predating the pandemic, and has been on the forefront of really digging into the things that will support child care across this country, and certainly in the great state of Minnesota, as we navigate through what will be a challenging economic recovery. So Senator Smith, welcome.
Well, great. Well, thank you so much, Jonathan and Christine. I really appreciate the Minneapolis Chamber organizing this very important discussion, and a shout out to my former colleague, Grace Walls, who's also on the call. And it's great to be with Chad Dunkley. I will tell a little story about Chad in a minute. And I really want to thank Jeff and Diane and ReadyNation for that really incredibly thorough and smart summary and overview of the challenges that we face in childcare. You know, I think one of you put it so well, Jeff, when you said we have a crisis in a crisis on top of a crisis, which is exactly the situation. Even before COVID, we knew that access to good quality, affordable accessible childcare is one of the biggest challenges that families in Minnesota and around the country face. And as we all understand, this is an issue of the health and wellness and well-being of our little kids. It is particularly an issue of equity when we see and understand the lack of access and how that's even worse in communities of color and in rural communities. And it's also an economic issue, because if there isn't good childcare, then our economy doesn't work. I probably hear from employers as much as I hear from families and educators about the need for good quality childcare around Minnesota. And as Jeff made the point so well, we have a complex network of childcare system. It's really like infrastructure in our country that includes home care providers, it includes centers, it includes, depending on the age of the child, Head Start and schools. And that network is unbelievably stressed. It was stressed before COVID, but now it is even in a worse condition. And some have estimated that we run the risk of losing up to half of our childcare providers in the midst of this COVID pandemic. And you think about the unbelievable stress that families are under right now, and also these centers that work so hard to provide this service. They, you know, I really truly believe that almost everybody that you meet in the childcare sector, they're doing it because they love children, because they have a passion for making sure that children get a great start in life and that families have the support that they need, whether that is the neighbor down the street who's providing home care services, or whether it's Chad and his family at New Horizons that his mom started. And so this is not about people trying to figure out how to make money. It's about people trying to figure out how to have a business that they love and that really takes care of families and kids. So, you know, in last year, I did a significant amount of travel around Minnesota, digging into the challenges around access to childcare and what we could do to fix it. And one of the things that I learned, this was before COVID, that there's just sort of fundamental challenges around the business model of childcare, right? Because the most important thing is the teachers and the educators, and you need a very high level of teachers to, ratio of teachers to kids in order to have a good quality setting, a safe setting for kids. And it just is, it's very, very difficult. The costs are high, they're fixed costs, and then meanwhile, you've got to figure out how to make sure that kids are getting the very best. But then when COVID hit, I realized what a great threat we were under. And a lot of that was because of conversation. Gosh, Chad, when did we have that conversation? I think it was like March 19th is what my notes said, when I sat down with you and a group of other providers. And I talked to people with tears in their eyes who were seeing this, the work that they love so much, just so deeply threatened because of what was happening with COVID. And the challenge, because parents were keeping their children home, and so they had a precipitous drop in enrollment, yet they were trying to stay open in order to serve the children of essential workers, and they were just so deeply struggling. When I heard about what was happening here, and with lots of consultation with Chad and many, many others, I went to work to figure out what we could do legislatively. And that was really, those conversations in Minnesota were really the genesis for the bill that I have introduced in the Senate that is called the Child Care is Essential Act. And I'm happy to say that the companion legislation in the U.S. House has actually passed. It passed as part of the HEROES Act with bipartisan support. And what this piece of legislation would do is to get at some of the issues and challenges that Jeff and ReadyNation laid out, and that I heard in my conversations with Minnesotans all around the state. It would provide grants to fund childcare for essential workers, to get resources in there right away for centers and for parents that need to figure out how to pay for childcare. A lot of people who don't have kids, little children, don't realize that I think on average a childcare a year of childcare costs roughly the same as a year of tuition at the University of Minnesota. So it is extremely expensive. This would help to address that for essential workers. We also would fund childcare providers, including family childcare providers and home providers and group, home providers, to help them cover some of their exceptional costs as they are seeking to move through the COVID pandemic, to help them cover, for example, additional costs for sanitation and improving air ventilation and improving their facilities, and also to help them cover some of the great expenses that they have as well. And but just as important, this bill is the goal of this bill is to establish a kind of a plan and a strategy for building back stronger. So we not only help childcare providers, home providers, and centers survive through this really, really challenging time, but also be able to build back better and stronger. And that, I believe, is such an important part of strengthening this infrastructure for the long term. I want to just thank all of the providers and people that I've talked to all over the state who have helped me to understand, me and my staff to understand this issue and then put together legislation that would be extremely helpful and get, kind of keep things moving in the right direction, get things moving in the right direction again. The price tag, I want you to just think about this for a minute. The price tag for this legislation is $50 billion. Now, you might think, oh my gosh, that's so expensive. Like, how could we ever afford that? But, in March of this year, we provided $50 billion to help shore up the airline industry. And I believe so strongly that our childcare sector is just as important to our economy. It is just as important to our families, maybe even more important in terms of the day-to-day functioning of our economy and the day-to-day functioning of families than anything else that I can think of. This is, I believe, legislation is very much on the right track. We're hoping to move it forward and look forward to a continuing conversation with Minnesota employers and families and providers about what else we need to do to make this part of our economy work well. So I really want to thank Jeff so much for your presentation. You hit so many of the important points and important challenges that we have in childcare. And I want to just maybe close with one last thing. As we think about the significant issues around equity and racial equity that we cope with in Minnesota, and we know that Minnesota has some of the worst disparities in outcomes for children of color compared to white children, think about the power of high quality early education to address that opportunity gap that these little ones have. Preschool studies since the 1960s have shown that early childhood education can slash the black-white kindergarten achievement gap in half. And we know that early education has a profound impact on the development of children's brains. And in 2015, the President's Council of Economic Advisors estimated that for every $1 of investment in early childhood education, that $1 results in about $8.60 worth of social benefits. It's so difficult to quantify, though we try to, the power and the impact of high quality early education that parents can trust, that children can love. But we all know what that looks like in the faces of our own children and grandchildren and the children that we see around our communities every day. So I'm just so grateful for the childcare sector that has been working so hard over the last many months to try to hold on. And I want you to know that I'm your ally there, and I look forward to working with all of you to continue to make progress in this area. So thank you so much, Jonathan.
Thank you, Senator, and look forward to the discussion that we'll have. Before we do that, as I mentioned earlier, we're joined by Chad Dunkley, CEO of New Horizons Academy. Chad, literally of all of our panelists, you are on the front line every day, living and breathing everything that we're talking about here, from the importance of childcare, the challenges that we face, and this global pandemic. So grateful to have you here to share some insights into what the care centers are experiencing.
Thank you, Jonathan, and thank you so much, Senator Smith and Jeff, for highlighting these challenges. I thought from a provider's perspective, I'd tell you what happened during COVID. This is the conversation the Senator and I had In mid-March, we went from 73 schools in Minnesota caring for over 10,000 young Minnesota children to about 2,200 in a matter of weeks. We had to take drastic measures just to help our company survive. We had to furlough about 2/3 of our early educators. We had to beg our landlords to let us delay rent. All of the officers of our company immediately stopped taking salaries. We reduced our management team's salaries and have just been hanging on. And though more families have gone back to work here in Minnesota and our schools are starting to get more kids, we're still running at about 50% of our pre-COVID capacity. And that's true about across the country, between 40 and 60% if you look at demographics. And yet at the very same time, we're working our darndest to keep our kids safe and reduce any spread of COVID to either our teachers or our children, which means that we have additional expenses of PPE. We're trying to keep our children in smaller pods and protected. There's research by the Early Care and Education Consortium from Washington, D.C., which represents childcare centers and has been gathering data. Our costs are up about 33%, including additional labor costs of escorting children to and from classrooms, health screenings, to additional costs in the classroom. And so you have an industry that was fragile before that lost 50% of its, first of all, it lost 70 to 80% in the early days, and now about 50% of its incoming tuition and revenue, and costs are up 30%. So we have a very fragile industry. We've been fortunate here in Minnesota. Minnesota's done more for their childcare providers than any other state. Governor Walz and the legislature passed peacetime emergency grants very early in the process here of this terrible stuff. The CARES Act from Congress, Senator Smith was a champion of that. It was smaller than we wanted, but it got back here helping for a few months. Our governors continued to look for funds during his emergency. But Minnesota, like other states, we're running out of money. Minnesota has a budget deficit. We only have a few months of these grants left, if that, and we're in trouble. And so what Senator Smith said is absolutely true. This industry was critical before we hit this pandemic, and it could be wiped out. And we can't wait for an election. It has to happen before early next year, or as Senator Smith said, the research shows we'll lose half our child care providers. One other comment I want to make, because I know you want to get a chance to questions, about affordability. From a provider perspective, I want to explain something. People often ask why child care costs more than college, and yet we all know early educators are professionals and deserve to make far more. I want to explain that briefly, because I really think sometimes the answer people think is try to make something cheaper. Child care is not getting cheaper. There's no way it's getting cheaper. And the reason for that is all the research says you need really small ratios with highly trained early educators who understand attachment theory and can connect with children and know how to scaffold their learning. You need small ratios, and the business community needs us to serve families full day, full year. Our schools are open 12.5 hours a day. So when you have children with you, 2,000, 2,500 hours a year, 9 to 10 hours a day with a full day of work and commute, and you're at small ratios. My average teacher-child ratio in a school is 1 to 6. That's a lot more than colleges where you attend class 12 to 15 hours a week, 6-7 months a year, often in classes with 100 students. So you know what, early childhood should cost a lot more than colleges or universities. And public schools only serve kids about 1,000 hours. And so when it comes to the childcare crisis, and I want to comment one more thing, I don't think we have a supply problem. If we had consumers that could afford high quality, you'd see a lot more supply. I mean, I'll give you an example. In Minneapolis, we came up with a scholarship program just recently that we could combine with funding, and I opened 3 schools in inner city areas, one off Penn Avenue in North Minneapolis, and South Minneapolis off Lake Street, another one in St. Paul. I think the issue is we have consumers that can't afford what it costs to provide quality. And that's true here in Minnesota, in rural areas and across the country. There's plenty of childcare in concentrated high-income areas. There's not enough childcare in middle-income areas because we don't do enough to help them. In Minnesota, in the Twin Cities, if you have an infant and a preschooler, it costs you $35,000 a year for a full-time infant slot in a New Horizon Academy and a full-time preschooler. Now, we're all accredited, 4-star rated. We have degreed teachers. We're proud of the work we're doing in our classrooms. But what family can afford it? Nationally, they say you shouldn't spend between 7 and 10% of your take-home pay on childcare. That means we should be helping families if they make $350,000 to $400,000 a year. That should be the cutoff, not families at $30,000 a year, and then all of a sudden they lose their child care assistance and their child care costs more than their income. So we have a crisis in this country of supply because we have consumers who can't afford what their kids need. We know what kids need. They need quality. We know that kids need small ratios. We know that families need support all day long when parents work. We have to have the hours that we're serving. We're not making this cheaper. We have to face the fact that good quality childcare should even cost more. Early educators should make more, but more families need help right away. Because it's when you have that first baby and somebody tells you it's $400 a week for childcare, that's the day that a family decides if they're going to leave the workforce. That's the day when these long-term decisions are made that affect a family's earnings and income for a lifetime. And so we have a lot of work to do in this country, and I hope this pandemic will make sure that we never forget it. So I appreciate it, Jonathan. I look forward to a continuing conversation on this issue.
Well, thank you, Chad, and thanks to all of our panelists. We are going to migrate into some Q&A, so looking forward to that. I think the point about the economic impact has been well made today. $57 billion cost to the economy, $13 billion cost to employers, and that's without even getting into the labor access that Chad, you framed out. On the other side of that workforce equation is the reality that these young people, 3 years and younger, are our future workers, and you are engaging them in what is one of the most critical times in their life. There's a current Itasca working group that is looking at the first 1,000 days from gestation to about the age of 2 or 3 and really digging into what employers might be able to do. Chad, I may ask you to think about that role and how your centers are thinking about the critical role you play as childcare educators in those vital first days of life.
Yeah, I mean, the brain research is so powerful, and it develops quickest from 0 to 3. And so children need a lot more quality, intentional instruction and interaction than they get when they're sitting at home right now where parents are on Skype meetings. I mean, we really have a lot of families with little kids suffering. But one thing early childhood does is it's not just academics. It's the social, emotional skills. It's learning how to cooperate and work with others, to wait your turn, patience, all of these things, self-regulation, things that we know as employers, we absolutely want in an employee. As citizens, as friends, as parents, as whatever we are in society, so much young children learn in those first years about how to be a better citizen. All of those things are things that children are missing out on, and they're missing it out on in K-12 too. I think we're going to have this pandemic's going to cause some problems. We're going to have some remedial work to do to give children of young children and all the way through elementary school, the opportunities they're missing, in particular with social development.
Thanks for that. I think we keep hearing over the course of this conversation, this really scary stat that upwards of 50% of centers could close as a result of this pandemic as early as January. Jeff and Diane, I think I'll turn to you. You framed out the issues that we were having before the pandemic. Post-pandemic, we recognize that deep subsidy is probably part of the equation, but could the two of you speak to some of the policies that maybe need to be changed pre-pandemic that almost certainly continue to need to be evaluated as we think about this issue moving forward?
Absolutely. Thank you so much for the question, Jonathan. And I thank you and the work that you've done in Minnesota in making that connection between how childcare really is essential to growing our economy and is a workforce issue as well as a child development issue. And so I know that leaders such as Senator Smith and others on both sides of the aisle in Congress have really started to take notice about that connection, both in development as well as in economic drivers. But we are right now at a very critical time with child care providers not being able to sustain their business operations at the end of the day. As much as they care about kids and care about supporting parents, fact of the matter is the numbers just do not add up. And so having an investment in childcare right now is really important. And one of the things that ReadyNation business leaders have gotten behind is that Childcare Stabilization Fund, which is funding that can be direct grants to all childcare providers. Again, this is for quality childcare providers. This is for both home-based, family friend network providers, center-based providers that would particularly address the increasing costs of doing business under the required health and safety requirements. And it also addresses the enrollment caps that are going on. What a lot of folks don't really make a connection to is that kids our providers are reimbursed on a per head basis. If a lot of times if kids are not showing up, their fixed costs remain the same, but they're not getting the tuition payments there as well. So they are facing closure because of that. And so being able to sustain the business so they can continue their paying their employees, continue being open, and address those costs is really important. So we're advocating for a dedicated funding stream through childcare stabilization that is accessible to all quality childcare providers, regardless of whether they're CCDBG providers, regardless of where of who their target audience is or where they're located, but they can access those funds. In addition, because we do have a shortage of care, and in particular, as you mentioned, Jonathan, subsidies for low-income parents and allowing them to return to work and to continue working is important. But also, we have to look at expanding the supply. The demand far exceeds the supply. And so by investing also in additional resources in CCDBG to help families afford quality care is also part of our push. So the time is now to act. We simply must sustain the childcare sector, and we are asking Congress, both houses, both parties, to come together for a childcare stabilization fund.
So Senator Smith, you kind of teased us a little bit with the Child Care is Essential bill that you dropped. I've had an opportunity to spend quite a bit of time with your team. The Chamber is supporting that legislation, and I think you've done a nice job of framing it in the context of the investments we're making to shore up the airline industry, which is another critical part of our economic infrastructure. Can you give us a little bit more insight into what that bill looks like, where it is at today, and what the prospects are for a bill like that moving forward? I think we've got you on mute, Senator.
There you go. Now, am I off now? There we go.
That's the theme of 2020. You're on mute.
I know it exactly. I just was thanking you and also really appreciating partnering with the Chamber on this issue. I mean, I've got to tell you, I've talked to families and parents all over this state, and this isn't a Republican issue or a Democratic issue. This is an issue about whether your family works and whether your community works because you have access to childcare. And honest to God, I've got to say that it doesn't have to be this way. I mean, there are lots of other places have figured out how to make sure that you've got that infrastructure of childcare in great diversity in place for families and for businesses, because it is so much a part of the economic infrastructure too. I want to just come back to something that Chad was talking about, which is that how you made such a great point, Chad, about how the way you have to provide childcare means it is expensive because you need to have low teacher to child ratios, and you can't control those costs or like drive the cost curve down when it comes to childcare. What you're trying to do is expand quality. And a lot of people don't realize that the average childcare worker, this is data that I got from DEED, the average childcare worker in Minnesota, this is probably a couple of years old, makes about $20,000 a year. So that means that they are struggling to figure out how to provide care for their children while at the same time they're trying to do this work that they love so much. One of the things we need to do is to figure out how to beef up pay for workers. And this isn't something that I'm putting on Chad or the daycares or the centers like New Horizons Academy. I'm saying we need to just get more resources into the system. And that fundamentally is what our Child Care Stabilization Fund would do. It would be a dedicated source of funding, and it would allow but helps centers to cover their costs in the short term and make improvements that they need to make so that they can function in this COVID world. As Chad said, expenses are going up while revenues are going down, but would also help them to build forward for the long term. And long term, what we need to do, and I think maybe Jeff mentioned this, I believe we really need to figure out how to provide more subsidy, more support for kids and childcare, because that's the only way that the economics of this is going to work. It just won't work otherwise. I think that's absolutely essential.
And Senator, I think you hit on something really important, and that's the wages in the childcare industry. We talked a little bit earlier about some of the disparities that exist, around childcare and the actual youth that are being served in the families. We also recognize that the childcare industry is disproportionately, led by women, particularly women of color. And as you think about, gender equity and gender justice, how do you think about that connected to the legislation? And I may frame that for Chad as well, as you think about your employee population.
Yeah, well, let me go quickly, and then I'd love to hear what Chad has to say about this. But it's touching to me that you are asking that question as we are all mourning the loss of Justice Ruth Bader Ginsburg, who did so much to change the laws of this, so much to advance the value of equal pay, equal opportunity for women as a matter of basic equity. And we still, of course, have so much work to do. And you are absolutely right. So many women who work in childcare, so many women who work in education generally are undervalued. And you look at what they are paid relative to their educational attainment, and you compare that to what people would be getting paid, men would be getting paid in addition in other fields, and you see a great disparity. So, we have lots of work to do here.
Jonathan, if you're looking for my comments about wages, it's a lifelong passion of mine. There's nothing more important than early educators and raising their wages. And one thing, New Horizon doesn't have schools all around the state. One of the main reasons for that is there are parts of Minnesota where I can't pay a livable wage. And though when you say Senator Smith, $20,000, my starting aides are $12 or $13 an hour. My teachers are 18, and that, or even 20 if they have a higher degree and more experience. But that's the biggest difference between the cost of childcare in some places like New Horizon, where I want to be rated, I want degrees, but realistically, I'm unaffordable for many Minnesota families, but I'm not willing to pay less. But it is a huge passion of mine. Like I said, we're not going to make this cheaper. It should cost a lot more. There was a research by the First Children's Finance in, I think it was 2017, that said the average family childcare provider in Minnesota pays themselves $8 an hour and works 13-hour days. So when we wonder why we're losing family childcare providers, we're losing them because they can't afford to support their own families. Yet every time they go to raise tuition rates, families struggle to afford it. And so we have a huge crisis in our hands, and early educators should make more. It's the biggest problem with the industry.
Chad, we have a question from the audience, framing this idea that it feels like in-home care providers are being pushed out. Jeff and Diane, I think when you talked a little bit in your presentation about in-home providers and the need for resources, and that those resources needed to be both for centers and in-home. Can you expand on that a little bit, and what we might do to support in-home providers, especially in this moment where those neighborhood in-home care facilities are increasingly important?
We're happy to. Thank you for the question. And as we said, in partnership with Chad, who has an amazing business model, and other centers, providers across the country, what ReadyNation is saying is that childcare looks different, but in the same way, they should be the same. They should be quality, they should be affordable, and they should be accessible. And there should be choice for parents. And so we want to instill, and we have the great business leaders of ReadyNation behind us, the same issues of quality and access to professional development that some of the center-based providers would have to our home-based care providers. providers. And the quality ratings should be within CCDBG, should be adapted and looked at so that home-based providers can also move along that echelon for reimbursement rates in certain in the states with CCDBG by reimbursement rates. I should stay there. So within HHS ACF, the Administration for Children and Families, there are some in-network supportive services that are available to FFNN providers that are CCDBG providers. We would like to build on that network of peer support, quality support, education support, and include the professional development opportunities for all of home-based providers, all child care providers, so that they can begin to move up. Now, that does mean that we have to look at the subsidy rates for CCDBG, and we have to take a look at that, and including those who meet the quality standards in the FFNN network, as well as a home-based provider care network, that they can be reimbursed equitably as well. So I do think that looking at professional development should be a part of our child care policy development for home-based providers. Also looking at supports, in-network supports within the state, region, localities to support FFNN providers, which again, a lot of, we just have to be perfectly frank here, a lot of low-income families rely on family friend network providers for their home-based care. A lot of shift workers rely on home-based providers because it is not economically viable for a center-based model sometimes to be available in those non-traditional hours. So looking at including and improving quality for all providers is absolutely necessary, and building on some of the steps that the 2014 Child Care Development Block Grant federal policies started, and expanding those in our next go round. I hope that answers your question.
Yeah, thank you for that. You know, Chad, I think you've hit the point that child care should be more expensive and high quality child care should be more expensive. We've got a question here, recognizing that there's a subset of our population that just simply can't afford the current rates of childcare, certainly may not be able to afford a more expensive version of childcare. Maybe a question to Senator Smith: what could we do right now to assist those families that need that help, particularly in a time when they're no longer receiving that unemployment top-off that had benefited so many people who were struggling before the pandemic?
Sure. Well, I mean, we could pass my bill right now, and that would help. That would help to get emergency grants to child care providers and emergency support to families that are struggling to afford child care. In the long term, we also need to increase the subsidies that we are providing, or get other ways of getting dollars to families so that they can afford the care that we need. I mean, I remember when I was working as lieutenant governor, and every year Governor Dayton and I would try to figure out how we could increase the dollars that were available in the child care assistance program. And we would, the governor would always say, I want to clear out that waiting list so that nobody has to be in a waiting list because we don't have enough money in there. But as soon as we put more money in, more dollars, more people would show up on the waiting list, because the demand, the need was just so outmatched by the supply. I would just ask people to consider, what are the costs of not doing this? What are the costs of not taking this action? There is still going to be a child there that is not able to get the care that they need. There's still going to be a parent that is unable to go to work and to contribute to growing their family's income and growing the prosperity of their family, because they just can't, because they can't find a good place or any place for their child to be. The costs of not doing this are so great. And I just, when you think about this is just sort of captures it. 2/3 of the zip codes in Minnesota are childcare deserts, meaning that there are 3 little ones for every open and available spot. Now, that was before COVID. You've got to imagine that it's getting worse and not better. And it gives you a sense of the cost of not doing something here.
Thank you, Senator. Dad, a lot of parents right now, myself included, largely working from home. The governor's executive order suggests that we must work from home if we can, and it's working out to varying degrees. I am the parent to 4 distance learners right now, so we are navigating that. What impact have the stay-at-home orders had on your center specifically, and on centers across the state of Minnesota?
Well, that's a great question. And Jonathan, in the beginning, of course, we, as I mentioned, went down to about 20% of our capacity, and we've started to move back towards 50% of our capacity as different parts of Minnesota's economy and workers had to go back to work. But, you know, before this pandemic, we did a little research. About 35% of our families were essential workers, doctors, nurses, frontline workers. They were scrambling to do what they thought would be short-term arrangements. And many of those families, that just can't work for long term. So we are seeing children come back. We are also seeing families. I'll tell you one story. One of our schools had a family had twin 3-year-olds. And the mom and dad both end up on Skype meetings all the time. And they decided it was no longer safe. The children might not make it because they found one behind the seat of a car trying to turn the car on and the other on top of a refrigerator, all while they had crossover in their meetings. We can't expect Minnesota parents with young children to continue to provide what they need and do their jobs effectively. We can tell you that providers, you know, there's no guarantees. We have a lot of precautions in place. And though you may be working from home, you know, check out what your providers are doing. There will be some families clearly that don't come back and won't come back until they're fully back in the office. But I think it's a lot to expect Minnesota parents with little kids to be an effective parent and an effective employee at the very same time.
I can certainly attest to that. I am looking out on my kids on the trampoline and what can only be described as some sort of WWE event that they're hosting right now with the neighbors. So we are not surprisingly coming up to time. As we prepped for this, I think this group acknowledged that we could spend a whole afternoon digging into all of the dynamics of childcare. But I think I'm going to ask each of you to do in kind of a rapid fire, 90 seconds or less. We've got a captive audience of well over 100 leaders in our community who understand the importance of this issue. You know, I always like to leave our audience with one thing they could do, one tangible thing that they could leave this time together with that would help advance the issue of whether childcare affordability or access or equity. And I think we'll start with Chad, move to Jeff, then Diane, and we will allow our esteemed senator the opportunity to give us a last word.
I think you've got to talk to policymakers. Minnesota actually passed the first child care reimbursement rate increase in like 8 years because we got 14,000 emails to Minnesota legislators. Legislators were telling us that they haven't heard on a single issue more than they heard about child care during this process, which is why Minnesota's done more for its providers than anything. It doesn't take many of us to say this matters. But right now it's pressuring Congress to do something because that's the only people in this country, that's the only place where you can get enough money to stabilize this industry so it's not wiped out into next year as families return to work. But get active and make sure childcare is on your list of items that you talk to, whether it's your US Senator, whether it's your state representatives.
All right, we'll turn it over to Jeff.
Great, thank you. I mean, I would say if you are a business person, your voice makes a big deal. We know that members of Congress definitely want to hear from employers about struggles they are experiencing in relation to the child care crisis during the pandemic.
And I would just say that this is a bipartisan issue, and the voices of business leaders urging action to come together to strike a deal for Child Care Stabilization Fund is absolutely vital and critical now. We have seen proposals from both sides, as I said before, the aisle, and both houses of Congress. So we all know where they all stand now. Let's come together, strike a deal, and get it done. I think that we have got to continue to force on both sides of the aisle to seek a compromise for that. And who is better but business leaders and knowing how to strike a deal?
And Senator Smith.
Well, I want to, first of all, I totally agree with everything that everyone has said in terms of taking action on this. We need to organize a big, broad coalition for supporting additional funding and additional support for childcare. And it does have to be bipartisan because it won't stick if it's only one side or the other. And one idea I have is that as you think about the people that are on this call, the Minneapolis Chamber is showing great leadership the regional chamber, I mean, you represent regional chambers from across the city, you're showing really great leadership. You all should be thinking about how you could engage other chamber organizations around the state or around the country to also lift up your voices, because I think that it is not understood enough that this is a business issue and an economic issue, as well as a child and education issue. And so think about that. And, you know, I'd love to see the U.S. Chamber advocating for stronger support for childcare. And I'd love to see, you know, bills like mine and other bills be brought to the floor of the United States Senate to at least be debated and discussed. And that is the next step for moving forward.
Well, Senator, I'll take that as a personal request and challenge, and we'll see what we can do there. I want to thank each of our panelists today. Chad, please extend our gratitude to your entire team, especially the frontline workers who are really the magic that is allowing so many of our employees and our critical employees across our region and state to get back to work as we head into reopening. Jeff and Diane, thanks for the continued partnership with ReadyNation on any number of issues. This one's certainly not just emerging, but becoming more and more important.